Fred, should we get going?
Yeah, well, let's get going. I'm Fred Murphy from the Marxist Education Project. I want to thank you all for joining us today. The book talk on an important and unique new book, Liberating Abortion, claiming our history, sharing our stories, and building the reproductive future we deserve. We're very happy to have Regina Mahone with us today to present this work, which she co-authored with Renee Bracey Sherman. Regina is a senior editor at The Nation magazine, where she runs Repro Nation, a monthly newsletter about global efforts to protect reproductive freedom. And with Renee Bracey Sherman, she co-hosts the podcast, The A-Files, A Secret History of Abortion from the Meteor. Regina has written for publications including Cosmopolitan, Elle, Rewire News Group, Romper, The Nation, and Truth Out. So let me turn things over to Regina, and we'll get started. Hopefully a few more people will be joining us in a little while, but in any case, we're ready to go.
Awesome. Well, thank you so much, Fred, and thank you to the Marxist Education Project for having me to talk about liberating abortion. This has truly been a labor of love, and so to be able to share it with everyone just means so much. So thank you all for being here on a Sunday, on a beautiful Sunday at that. So my goal today is really just to discuss the way race and class intersect with abortion rights, so that hopefully by the end of this talk, you'll have a clearer understanding of these issues, and in particular, why Renee and I argue in our book that abortion is anti-capitalist. And so I wanted to just get a sense from everyone. Has anyone seen any of the anti-abortion billboards? They're typically in like racially segregated communities, maybe like the poorer part of the town or city, on which there's generally like a Black child or a Latinx child. Does anyone, and feel free to just, you can unmute yourself or if you want to write in the chat, but I'd love to hear from you all just if you're familiar with these anti-abortion billboards. Yeah.
I've seen a few.
Yeah. And so in 2011, there were ones specifically that said, the most dangerous place for an African American child is in the womb. And there was a version for Latino communities that said, for the most dangerous place for a Latino child is in the mother or in the womb. And these billboards are horrendous. They're also, in my mind, the clearest example of how the right uses race to shame women of color for their reproductive decisions, and not just our pregnancy decisions, but also, as we talk about in the book, how we view our sexuality and whether or not we seek out pleasure in our lives. And I'll get into that a bit more later. But we write in the book, and we start with the history of abortion because we wanted to explain to everyone how it wasn't always that way. So prior to the criminalization of abortion in ancient times, and we're talking like ancient times, people had abortions using herbs in their gardens. We have a few of the herbs actually on the cover of the book. We have Queen Anne's lace and pennyroyal on the cover of the book. And people would drink teas made from these herbs. They'd have concoctions at their grandmother's house, at their neighbor's house. And access to an abortion, which it wasn't even called an abortion at that point, it was just like bringing your period back. Access was not dependent on your status, your income, because people were relying on abortion methods that had been passed down through the generations, through trial and error. But in the late 1800s, that was when the American Medical Association and Horatio Storer in particular launched this crusade against abortion in the United States. He and the American Medical Association laid the foundation for what we're seeing today, this like present day capitalist anti-abortion movement and the medicalization of childbirth and labor specifically. So Storer and his ilk made it so that only doctors, you had to be an OBGYN, you had to be part of the AMA to provide abortions. And of course, at that time in history, women weren't part of they weren't allowed to be part of the AMA. only white doctors, only white men doctors could be AMA. And those were the only people who could provide abortions, and they got to decide when an abortion was necessary. And like I said, before then, everyone, was in control. The people who were pregnant, the people in their community, midwives, herbalists, those were the people who were making the abortions happen. But once the American Medical Association started to professionalize the medical industry, we saw that it became a doctor's decision, right? And so they set up a system in which these midwives, these herbalists, other people who were the actual experts on reproductive health, maternal health, they were stigmatized, they were delegitimized, they were called quacks. The practices were identified, they were called barbaric. And so, of course, at this point, maternal mortality, and that's when we start to see that, and we're seeing, of course, the legacy of that today with maternal mortality and infant mortality. But when the American Medical Association pushed out midwives, called them quacks, that's when we started to see an increase in those deaths from pregnancy-related deaths. Because the doctors, these AMA doctors, were not the actual experts of reproductive health. They hadn't given birth, they hadn't performed childbirth, so we start to see the medicalization of birth, of labor, and what they saw was, in doing this, it was an opportunity to control not only our reproductive lives, but the means through which people were actually making a living for themselves, right? These midwives, and caring for their communities. These were predominantly Black women, immigrant women who had, these callings, they were working as midwives, and then they were immediately pushed out. And these doctors were driven by this idea, this white replacement theory, that the immigrants in the United States and other non-white people would outnumber them if they didn't stop white women from accessing abortions and controlling their family size. So that's the origins of these abortion bans that we've seen in this country. And so now we also have this professionalized healthcare system in which providers and their staff are free to discriminate against their patients because they have all the power in this situation. We share in the book Representative Cori Bush's experience because it offers a concrete example of the ways in which Black girls and women have to navigate healthcare and racism in the healthcare system while working ourselves to the bone to cover the cost of care because it's become so expensive. So I'm going to start with just my first reading. I'm going to do a couple others. This one, again, sharing Cori Bush's story. That's in our book. Shortly after graduating from high school, 17-year-old Cori Bush went on a church trip to Jackson, Mississippi. She dreamed of attending a historically Black college or university, but became lost when her grades slipped as a result of bullying, and she had no chance of securing financial aid. On the trip, she met a friend of a friend, a 20-year-old man who made her laugh and later asked to stop by her hotel room. She obliged, thinking they would continue their conversation, but when he showed up late that night, he raped her without saying a word. Shocked and frozen, Cori didn't know what to do. After the rape, he simply got up, dressed, and left her room. Later, when Cori discovered that she was 9 weeks pregnant, she attempted to reach the man, but never heard back. She felt alone, but knew what she wanted to do. Cori found the number of her local clinic in the Yellow Pages and made an appointment at Planned Parenthood. The cost of the abortion was more than $300. Cori worked part-time for minimum wage, then a little over $5 per hour, and it took her a few weeks to save up the money. In her historic 2021 congressional testimony alongside Congresswomen Barbara Lee and Pramila Jayapal, Representative Bush recalled her rape and degrading experience at the clinic. She told us that the Planned Parenthood clinic has since, quote, made huge, tremendous strides in improving its patient care. But that wasn't the case in 1994. Quote, what I faced was being treated like a burden, a subhuman, degenerate, she told us. I was this young Black girl, and I was there alone. Representative Bush testified that while in the waiting room, she overheard clinic staff making disparaging comments about another young Black patient, saying that she had ruined her life, and, quote, that's what Black girls do. During a counseling session, Representative Bush recalled she was told that her baby would be, quote, jacked up if she continued the pregnancy because her pregnancy was not healthy and she would end up on welfare. The degradation continued when she overheard white patients in the post-procedure room talking about how the counselors told them that their futures were bright and their options would be limitless. Representative Bush told us that she had her second abortion while attending a local HBCU. This time, she was more confident in her decision. Becoming a parent at that time was not part of her plan. However, her abortion was delayed until she was 12 weeks pregnant because she took time to make her decision, and it took a while to come up with the money for the procedure while a full-time student. Representative Bush felt it was important for her to highlight the differences in care and treatment between white and non-white patients because these are the disparities that contribute to poor health outcomes for our communities. Quote, you can't talk about abortion without talking about the barriers and limitations, she explained. She recognizes the hypocrisy of her colleagues who would rather that someone receive government assistance, give birth, and parent than have an abortion, while those same people, she said, work to defund government assistance and kick people off social safety net programs. She knows that that's not reproductive justice. We have to support and invest in all decisions all the time. Representative Bush infuses her personal experiences and those of her constituents in all of her policymaking. As a registered nurse and ordained pastor, a core part of Representative Bush's platform has always been healthcare for all, because everyone deserves access to healthcare regardless of their job or economic status. Quote, as I approach this work, she told us, it was me thinking back to those moments when I needed help. It was me thinking, what is it that I needed during that time when I did not have a lot of information about my reproductive health and understanding what was going on with my own body? Representative Bush is proud to share her story to change the narrative and infuse reproductive justice into the policy conversation because, as they say, the personal is political. Quote, we have nothing to be ashamed of, she testified in 2021. We live in a society that has failed to legislate love and justice for us. We deserve better. So when we spoke to the Congresswoman, she was very clear that her anti-abortion colleagues continue to fail to support programs and policies that would make Black and Brown communities safe for children of color, going back to that billboard and what was one of the many things wrong with it. And that's the whole point, right? They do not want to provide environments for people of color to thrive. Abortion bans are literally killing pregnant people, and they are looking for more ways to ban access now through abortion pills. They're trying to revive the zombie law, the Comstock Act, and we know from history that any restriction on abortion harms women of color first and worse. So now I'm going to do another reading from our book. It's from our chapter called What's Race and Class Got to Do with It? And in that chapter, we provide a more concrete example of a policy that is designed to harm poor women and poor women of color. And it has continued to do so for nearly 50 years at this point. But before I begin reading that chapter, I just wanted to ask, how many of you may have heard of the Hyde Amendment or are familiar with what it does? Feel free, again, you can unmute, or if you want to post a note. Oh, sure. Oh, you've heard of it, yeah. Yeah, definitely.
I haven't heard of it, actually.
Okay, great. Well, I've got some, boy, do I have a story for you. So thank you for sharing. All right. This is one of my favorite chapters. All right. So, by all accounts, Rosaria Jimenez was deeply loved by all who knew her. Rosie, as she was known to her family and friends, was outgoing, loved to dance, and enjoyed dressing up and wearing wigs that signaled her unique style and vibrant presence. Rosie grew up in a large Mexican-American family in 1950s McAllen, Texas. Her parents were migrant farm workers traveling to work on agricultural fields, later opening a Mexican restaurant while raising 12 children. Like her family, Rosie was ambitious. The 27-year-old mother wanted more for her young daughter, Monique, than what she had growing up. Receiving a meager $86 a month in social service benefits, Rosie worked hourly wage jobs to make ends meet, including cleaning houses over the weekend to provide for herself and her daughter. After passing her GED test and enrolling in a government-sponsored program for secretarial school, Rosie enrolled at Pan Am University in 1974. Shortly before her death, she received a $700 financial aid check, but she refused to use that check on anything other than her education. Quote, she was going to college to have a better life. That was her goal, her daughter Monique said in a 2015 Texas Observer interview. I know that she saw my grandparents struggle, Monique said, and she wanted to provide me with a better life. Rosie would do anything for Monique. Rosie's story has become an iconic and dire warning within the reproductive justice movement. For nearly 50 years, her death has served as a symbol for activists advocating for an end to the Hyde Amendment, a budget amendment that bars the use of federal funds for abortion coverage for Medicaid and Medicare enrollees in many states. Residents of Washington, D.C., federal employees, Peace Corps volunteers, and others. Although the Hyde Amendment certainly played a major role in Rosie's death, it was not the only player. But because Rosie's story had become larger than life in the movement, the full story and systemic failures, including those by people within the abortion care field, were overshadowed or erased. When we fail to tell a more complete version of her story and the stories of the countless others who have been affected by systemic injustices, we are destined to never learn from them. During our research for this book, we were surprised to learn that Rosie had 3 abortions after her daughter was born. 1 in 1975 and 2 in 1977. This shouldn't have been a surprise because most people who have abortions already have children, and nearly half have more than 1 abortion. However, we were surprised that this fact had been omitted when her story was retold. There's a tendency to flatten abortion experiences in the media or for advocacy causes, to tell tidied-up versions of our lives, to garner more sympathy and understanding, but all of us are much more complicated. For us, this fact changes the story a bit. Rather than the narrative we'd seen portrayed of a scared young woman who died with her final financial aid check in her hand, we see Rosie as a competent mother who knew that abortion was an option for her each and every time she needed it. Because they took place before the Hyde Amendment went into effect, Rosie's first 2 abortions were covered by her Medicaid insurance and performed at reputable clinics in McAllen and Harlingen. However, 2 months before she sought her 3rd abortion, the state of Texas changed abortion coverage based on the new rules of the Hyde Amendment. I'm going to get a sip of water. What we find tragic about Rosie's story, a part of the story that has been erased over the years, is that she was turned away from a clinic where she had received care previously simply because she couldn't pay. Not used to talking so much. It's devastating, to say the least, to recognize that Rosie's lack of cash on hand meant she could not receive, excuse me, my throat's a little dry. It's devastating, to say the least, to recognize that Rosie's lack of cash on hand meant she could not receive safe care and played a role in her death. Fundamentally, the story shows how class and race determine whether or not someone receives an abortion. The fact is that money, or lack of it, kept Rosie from receiving competent medical care, an issue that impacts communities today. The Hyde Amendment led to her death, but so did a system that values payment and profits over people. Unfortunately, this hasn't changed. In her book, No Real Choice: How Culture and Politics Matter for Reproductive Autonomy, sociologist Katrina Kimport writes about a young woman of color who was turned away from an abortion appointment because she didn't have cash to pay for her appointment. The clinic didn't accept credit cards or health insurance. By the time she realized this, the banks were closed, and she wasn't able to get the money she needed or time off work for a subsequent appointment. She didn't choose to continue her pregnancy. Capitalism chose for her. Clinics, of course, need to be paid for their services so they can pay their workers, afford medical supplies, and keep the clinics open. Most barely make ends meet as it is. Everyone is making difficult decisions in an impossible situation set up to privilege the profits of health insurance companies and to serve only those who have money and the access to healthcare that comes with money. So how did we get here? The effort to create a federal health insurance program for all began in the 1930s, but lost steam after World War II, when President Harry S. Truman asked Congress for legislation to establish public insurance. President Truman had to abandon the idea after facing fierce opposition to his plan, and this opposition was also from the American Medical Association, I should note, which included fear-mongering about the idea of, quote, socialized medicine. But advocates continued to retool the idea in response to growing needs among people age 65 and older in the United States and reintroduced it in the 1960s. After much debate, two programs were created: Medicare and Medicaid. President Lyndon B. Johnson signed the law creating these programs as part of the Social Security Amendments of 1965, 1 week prior to signing the Voting Rights Act. Both were monumental pieces of legislation that were products of the civil rights movement's attempt to right the status of Black people. Medicare became the federal health insurance program for elderly people and eventually some disabled people, while Medicaid insured low-income people in the United States. Because the structure of the public insurance program provides states with flexibility over how they comply with the federal standards to administer the program, state Medicaid programs vary significantly. Ultimately, states get to decide who is covered, what services are covered beyond some basic care, the models for healthcare delivery, and the reimbursement structure for doctors and hospitals. Reimbursement is slow and rates are notoriously low, sometimes not even covering the cost of the procedure. Thus, some providers don't even accept Medicaid, which limits where low-income people can receive healthcare. The rot in the Medicaid program is due to its original structure. The program setup allowed politicians to control the healthcare access of low-income people in the United States, whom they chastised for their family size, poor health outcomes, and low incomes based on racist assumptions, and therefore the program perpetuated the very issues it was created to eradicate. Using anti-Blackness and racism, along with fat phobia, classism, ableism, xenophobia, politicians have been able to denigrate Medicaid as an entitlement program, casting those who are enrolled in it as non-tax-paying and undeserving people, and thus experiencing less pushback when legislators enact cuts to the program. The overt racism allowed politicians to create a system that decides who is and is not worthy of free healthcare from the government. And those are, I'm putting quotes around free. So how did Hyde happen? Well, among other things, the Hyde Amendment was retaliation for the 1973 Roe v. Wade Supreme Court decision legalizing abortion nationwide. The anti-abortion congressman representing Illinois, who introduced the measure, Henry J. Hyde, made no secret of his desire to end access to abortion, but he knew that with Roe in place, his only option was to restrict it through the national budget. The congressman was vehemently anti-abortion, once stating that, quote, birth is no substantial change, it is merely a change of address. Representative Hyde worked hard to find a way to cut off access to abortion, and while he could not legally restrict the procedure, he knew he could cut off financial access for all who depended on the government's support for their health insurance. Pro-choice lawmakers organized in response to the bill and debated about the impact it would have on low-income people seeking abortions. Tensions were high as abortion had only been legal for a few years, and many legislators knew people who had been harmed by unsafe procedures before legalization. But Representative Hyde was callous and crude in his August 10, 1976 response. Mr. Speaker, let the poor women of America, this is Henry Hyde talking in 1976. Mr. Speaker, let the poor women of America make a list of those things that society denies them, which are enjoyed by rich women. Decent housing, decent education, decent food, decent income, and then say to them, now, those will take second place, but we will encourage you to kill your unborn children. Besides, there are too many of you anyway. This is still Hyde. If rich women want to enjoy their high-priced vices, that's their responsibility. They can get the finest heroin in the world that is not available on the street. They can get a facelift. They can fly to Vegas and gamble. That is fine, but not on the taxpayers' expense. During later debate on the House floor about the budget rider, Representative Hyde added, I certainly would like to prevent, if I could legally, anybody having an abortion, a rich woman, a middle-class woman, or a poor woman. Unfortunately, the only vehicle available is the Medicaid bill. Hyde believed that it was the government's role to intervene in the pregnancy decisions of all, explaining, quote, when the mother, who should be the natural protector of her unborn child, becomes its adversary, then the legislature has a duty to intervene. That intervention came in the form of a two-tiered medical system, one for the poor and one for the rich. After all, people with money would continue to access abortions as they could travel for care. I think it's so important to understand how Hyde happened because it's still in place. Both Democrats and Republicans continue to sign off on Hyde. And this history in particular that I'm about to explain gets to the heart of politics and how politics will generally throw women of color, Black women, under the bus. At first, the Hyde Amendment struggled to get through Congress. The measure failed to get enough votes in the Senate after Democratic Congress members argued that the purpose of the Medicaid program was to fund health care services for the poor, and the failure to cover abortion care would drive these women to, quote, ugly, brutal options if they could not access abortions through legal means. But anti-abortion lawmakers defended Hyde, claiming that although Roe legalized abortion, that ruling, quote, does not translate into an affirmative duty on the part of the federal government to use public funds to finance the termination of human life. After failing to pass the amendment twice in the Senate in fall 1976, Congress members agreed on a modified version that would provide exceptions for Medicaid-funded abortion where the life of the mother, this is quote, would be endangered if the fetus were carried to term. Former Planned Parenthood President Faye Wattleton observed in her memoir, Life on the Line, that the forthcoming election was what drove the lawmakers to go from not backing the Hyde Amendment to passing an amended version, explaining that they didn't want to be seen as, quote, disrupting government services over the single issue of abortion for poor women. They also assumed that the Supreme Court would rule against it, as everybody knew the bill was unconstitutional, Wattleton wrote. Indeed, President Gerald Ford vetoed the bill, only for Congress to override his veto. The bill became law on September 30th, 1976. A lawsuit prevented it from taking effect for nearly a year until the Supreme Court ruled allowing the restrictions. That is when Rosie encountered the Hyde Amendment. I'm almost done. So perhaps one of the most important legacies of the Hyde Amendment is how it rolled back gains civil rights activists had made in integrating a segregated healthcare system. Under President Johnson's Medicare program, hospitals had to provide services to both Black and white patients in order to qualify for federal funding. The Hyde Amendment created an avenue for doctors to deny Medicaid patients services, in this case abortions, and many of those patients were people of color. After all, folks with money, often white people, would continue to access abortions as their insurance covered it. At the same time that Medicaid recipients were denied their abortions, the Medicaid program fully covered prenatal and postnatal care, including labor and delivery. So, in essence, the government has been forcing people to be pregnant by making it easier for them to receive coverage to stay pregnant than to end their pregnancies. Make no mistake about it. Nothing about the Hyde Amendment is normal or okay. People should not be forced into a life-changing situation based solely on the type of insurance that they have. I'll take another sip. So when we were doing the research for this chapter, it became clear that the best way to tell the story of race and class and abortion rights was to tell Rosie's story. She was the mother of a 4-year-old daughter who lost her life because of a policy implemented by lawmakers, some of whom thought the law might never take effect, which I still to this day think is so wild. It did take effect. The Supreme Court gave its approval. Texas put it into place. Rosie went to the doctor she had gone to previously, couldn't get an abortion, sought an abortion from an unsafe provider, an illegal abortion, and she lost her life because of that abortion. But in the chapter, as I said, we also point out that it's not just Hyde, it's this entire system that allowed Rosie to go to a doctor, have that doctor tell her he couldn't provide her care because she couldn't afford it. That's the system that's killing people. And it was really important for us to provide this context because without the understanding of the root cause of her death, we're never going to learn from it. We're never going to be able to strategize around how we can center people of color if we're not acknowledging these truths about the systems we're operating in. And so, finally, I just want to end on a note about sexual freedom and our argument that abortion is anti-capitalism. But first, I just want to clarify our argument for abortion liberation, because I realized I didn't at the start do that. So we explain in the book that abortion liberation it's the act of freeing ourselves from oppression. For us, it's a vision in which everyone is able to have their abortions free from shame, stigma, oppression, and struggle. We write in our book, it's a vision where abortions are quite literally free, no cost, available to everyone, everywhere, whenever they need it. And these abortions are fully supported and met with unconditional love and understanding. That's our vision for abortion liberation. But we explain that this vision is much bigger than the Dobbs decision. It's bigger than the Supreme Court. We do not believe we can possibly get liberation through this institution. It exists solely to maintain capitalist power structures. We're seeing that more and more every term. So we argue for abortion liberation in our communities, and that includes doing the work of lifting up the importance of reproductive and sexual health information, and to encourage one another to seek out pleasure and sexual freedom in our own lives, because, as I'll read, and it's much shorter, it's just a paragraph, abortions are anti-capitalist. And so I'll read that section, and then we can wrap up, and I'll see if you have anyone has any questions. So although it is often overlooked or underaddressed, sexual freedom is a core part of abortion liberation. That is exactly why the people who are fighting against abortion access also want to ban contraception and resources for queer and trans people. Our bodies are a threat because they threaten capitalism, the status quo, and the political order that keeps power in the hands of wealthy, white, cisgender men at the expense of everyone else. But when we reclaim our bodies, which are a source of great power and deep satisfaction, we taste freedom. A world with abortion liberation frees our libidos from shame and stigma. When we see our sexuality as ours for the taking, rather than something to be ashamed or embarrassed about, we are releasing ourselves from the shackles of colonialism and white supremacy. We are reclaiming what was stolen from our ancestors and setting their legacies free. And we are creating a sex-positive, stigma-free path for future generations to follow, in making their reproductive and sexual health the foundation to freedom in a just society. And so when you think about abortion through this framework of capitalism, class, race, it's much easier to understand why the right is not going to stop seeking to ban abortion. They're going to keep creating even more justifications, sharing lies for shrinking this window of when someone can legally have the procedure until there isn't a window left. At the same time, the left has been complicit in our rights being rolled back by not staking a truly liberatory vision that isn't based on patronizing, patriarchal ideas about how pregnant people need a man or other person, their doctor, to help them make their decision. Or by ceding this moral ground to the religious right, instead of acknowledging our history, which we share in great detail in the book, of having abortions on our own terms, without medical intervention, unless it's needed, of course, and with the support of numerous religions and religious people who have always believed that the pregnant person deserves bodily autonomy and reproductive agency. The beautiful thing is that, of course, people are continuing to have abortions in this moment, and in fact, I think at the last research report that was released, there are more today than before Dobbs, and advocates everywhere are sharing information about the fact that abortions are overwhelmingly safe and that no one should be forced to keep a pregnancy if they're choosing otherwise. And I should also, because I haven't talked about abortion funds, we mentioned them a lot in the book, but they are by their nature socialist undertakings. They allow community members to fund their neighbors' abortions, and they have filled a gap that was created by the Hyde Amendment. The first one popped up after Rosie's death and has since become the Lilith Fund. But as abortion fund leaders have explained to us in pieces published by my colleagues and by myself at The Nation, our communities are not enough to help fill this hole that's grown since the Dobbs decision, when there are more people needing help paying for their abortions, and their procedures are more expensive because they've had to wait to get access because of delays at the clinic or having to travel across the state, across the country for care. And they're just, abortion funds are incredible and doing incredible work, but they need bigger infusions of funds in addition to the individual donations that we're all making. So we'll continue supporting them, and I encourage you all, if you're not already, to support them if you're looking for something to do and are able to do so. But we'll also just continue fighting for and building this liberated future that we deserve and that we write about and set a vision for in our book, Liberating Abortion. So I'd be so happy to take any questions if anyone has any.
Regina, it was a wonderful talk, and it sounds like a wonderful book, which I haven't read yet, but I'm looking forward to. So we can take questions if people have them. I have a couple of questions, but if anyone else would like to go first,
Sure.
Speak up. We're a small enough group. I don't think you even need to, raise your hand or do anything like that. Just, sing out.
I don't have a question per se, but I am thankful that you did the research and gathered this information, and it's digestible for me to read and understand what's really going on with abortion rights and the history of it and where it starts from, and all the amendments that I'm not necessarily aware of that come with abortion rights aside from Roe v. Wade. So it's interesting, actually. So thank you for doing that.
Absolutely.
Hey, my name is not Mei Ling. This is my friend's laptop. We were watching it together. But also to kind of add on to the conversation is that sterilization remains federally funded too. And so when abortion access is being revoked through federal funds, then a lot of poor people end up resorting to sterilization. And how that forced sterilization isn't even illegal. We still have a Supreme Court ruling that was established, I think, in the late 20s or 90s that
Foxy Bell.
Yes, which basically said forced sterilization is legal and okay to do. And that kind of connects the sense of ableism, classism, and misogyny and race all together, because it's a form of using the rhetoric of somebody being unfit and thus having to go to sterilization, the coercion of federal funds to encourage people to go towards sterilization instead of being able to have a choice in other forms of birth control or abortion. And so I wanted to add that to the conversation. It sounds like a really cool book, and I'm excited to read it.
Yeah, thank you. No, you're absolutely right. And that Buckney Bell decision in particular was looking, made it okay to sterilize people who have disabilities, who can't, making that decision, making their reproductive decisions for them. There's a long history in this country of taking away, either blatantly and explicitly taking away their reproductive abilities and autonomy, or doing it in more, we talk in the book about someone who had found out that they were pregnant on the same day that they got a deportation letter. And so what choice do they have? They're making a decision about whether or not to continue this pregnancy. Do they want to go through this pregnancy while also potentially going through this deportation process? And that takes away reproductive autonomy as well. And the same for someone who was incarcerated and found out that they were pregnant and wanted to actually get an abortion, but they couldn't because they were in a jail and it was too arduous of a process to actually get that abortion. And so they ended up staying pregnant, and now they have that child to raise. And it's all of these systems that, again, even just in your casual, not casual, but in your interactions with these systems can force you into situations and make decisions that you might not otherwise have made. And it is, sterilization is definitely an important part of it right now and what we're seeing. Thank you for raising that.
Yeah, this is Jacqueline Cantwell. I want to say thank you so much for this presentation, and I want to read the book. In the book, do you there were two things that came to my mind when I was listening to this, is that the lack of maternal care also for pregnant Black women, that the death rate for Black women is so atrociously high. It's outrageous in this country. And also, does it tie in just the neglect of the Black population, the lack of mental health care for so many of the mentally ill in New York City are Black men. And now it seems to me that there is, abortion is treated in two ways, right? There's like the white woman who wants to get her degree and she's somewhat sexually promiscuous, but will let her have an abortion. But then there's the Black woman, and it's a vindictiveness expressed toward the Black population. And this vindictiveness continues on to a lack of health care and just social supports. I mean, it's so distressing. I mean, I don't know if distressing is the right word, but it's really awful to see so many Black women die from poor health care. I mean, Woodhull Hospital right now is a scandal in Brooklyn. And thank you very much for this book.
Yeah, thank you for sharing that. We do, in our book, we're very intentional about centering stories and storytelling. And so we interviewed over 50 people of color who've had abortions, many Black women and Black people who've had abortions, and folks who don't identify as women, trans folks who in the book. And we do center their stories and experiences in this storytelling, and also specifically their vision for how we get free and how we liberate abortion for all of us. And so we do talk a little bit about, the maternal health care crisis, but all of these things are systemic issues that we've been experiencing for decades, for hundreds of years. And so the issues that you're raising, we're talking about the importance of, mental pleasure and all of these things that are really important for people to feel free in their bodies. And we are very intentional about trying to keep this as, with the Kirkus review, I want to remember what the language is, but like decidedly optimistic, for lack of. But there's a tendency when we're talking about these issues to focus on and it is an inundation of negative things that have been happening to us for so long. And so we do include in the book as well some affirmations from people who have gone through this experience to provide like an uplift and things like that. So I wanted to add those, not to directly, because I don't know if I can directly respond to your comment, but I did want to like clarify how in the book, like we really were intentional about centering the experiences of all of the storytellers we interviewed, who are experts on their own lives and their own experiences, as a way to show people how to talk about these issues, because it is really challenging, especially when you're not inside of these communities, to know how to talk about what's needed for these communities, if that makes sense. Hopefully that answers your question just slightly, but feel free if you have a follow-up question to ask.
Anyone else? Okay, I do have a couple of questions as well. Or one comment. I mean, I'm glad to hear you connect this in ways to the immigration question. I mean, immigrants right now are just being vilified and denigrated, and no one seems to be speaking in their behalf. The Democrats are, not standing up to the Trump onslaught. And it seems to me that the question of reproductive freedom and the attacks on it are tied to this so-called great replacement theory. That if they actually wanted to proceed with deporting millions of migrants from the United States, then they are also interested in encouraging the growth of a domestic and predominantly white population by restricting abortion, restricting reproductive freedom, especially for white women. If they want to, it's a natalist policy. It's the Handmaid's Tale. I mean, I don't need to tell you this. I'm just kind of
it's absolutely an extension
talking about
of
it,
that,
but
yeah.
It's important to focus on it. But the question I have is really more about the impact your book is making so far. I mean, it's been out for a couple of months, And
Yeah.
I'm curious to know if I haven't seen reviews of it. I'm
Mhm.
curious to know if it's getting a good reception and response, because it really deserves to be widely read.
I completely agree. I think one of the things we're witnessing is just what happens right in the weeks ahead of an election, where there is just and then how many wars are happening right now? Like it's really awful. And there's so many things going on, and so I do think you know, our book. And we were very intentional about not centering it around Roe. Like when we told people we were writing a book about abortion, they're just like, "Oh, what are you going to do now?" Because Roe, and we're just like, "Well, the book isn't really about Roe. Like it starts way before Roe, like thousands of years before Roe, and our vision is thousands of years, into the future for future generations." I was talking with my children when this started. I wrote this for my children because I want them to understand. We have explanations of their bodies and all. Just understand that this information is being kept from us for a reason, and that we can find it anyway and become empowered and self-determination and all of that. But yeah, I think that we're going to see, because we've had a huge tour, and we're still on it. We have several more weeks to go of events and things like that. And so we're seeing great reception in the communities that we've been in. And I do think a lot of the reaction we're seeing is more delightfully, in these small groups in person in real life. And that maybe there will be we'll see more reviews and things afterward when folks have a chance to catch up. But we're definitely seeing a lot of we're seeing good numbers of folks coming out to the events, and sending us feedback and things like that. But I do think this is the sort of book, because we did kind of pitch it as a resource guide, even though it's so much bigger than that. But that it's going to be the kind of book that is around for a while in terms of people finally digesting what's in it, because there is so much in it. I mean, we have an explanation in the first chapter. We have an explanation of how pregnancy happens, how every stage of an abortion. What is an abortion? Because a lot of people talk about abortion, but not everyone actually knows what an abortion is. Yeah. And so we explain what it is, and we offer how to track your cycle, and just fundamental sexual health information that's missed. So I feel like I'm repeating myself now, but I do think it's the sort of thing where we've gotten tremendous reviews from the traditional Kirkus, and I'm blanking on the other one, but the resources that libraries generally use and things like that. And so I'm excited to see where the book continues to go, because it is the book that both Renee and I wish we had when we were going through our abortion experiences.
It could become a companion volume to Our Bodies Ourselves.
Yeah. I actually heard from someone who, she said when she saw it, that was her first thought, just this is the next generation of it. And the fact that we get to center people of color who, need this information in our experiences in our communities. And we have a whole chapter on abortion myths that we hear, about ourselves and things like that. So hopefully, we'll see more as we continue.
Are there any plans for a Spanish translation?
That's a good question. I'll ask our publisher. I don't know.
Parenthetically, my wife was involved in translating Our Bodies Ourselves for women in Peru. For women in Peru when she was there back in the 70s. So
that's incredible.
Yeah, it would be great to see. Are there further questions and comments from our small but spirited audience today? Okay, well, as I noted in the chat, we will be, with Regina's approval, of presenting this on our YouTube channel. Please tell your friends and comrades to check it out when it's up. We'll send an email to everyone who registered for the event when that's available, and we look forward to seeing you at future Marxist Education Project events and studies.